You know that feeling, don't you? That moment when a seemingly simple situation suddenly escalates, catches you off guard, or maybe when you're just swimming in the sea of information trying to make sense of it all. I think we've all been there, right? Whether it's trying to juggle personal stuff or finding ourselves in really high pressure, demanding environments. So today we're taking a deep dive into something absolutely critical, workforce safety and wellness. Our exploration today, it draws from a really rich collection of articles and research. We're tackling everything from those internal battles like managing personal stress and grief to the external challenges, things like infectious diseases and hazardous environments. Our mission for you, the listener, is basically to give you a shortcut. Think of this as a kind of strategic roadmap, helping you understand the essential elements of staying safe and well, no matter what challenges you might be facing. We're going to uncover some genuinely surprising insights into how our bodies and minds react under pressure. And maybe most importantly, equip you with practical steps to mitigate risks, both in your daily life and in those really demanding high-stakes situations. So what's on our radar for this deep dive? We'll zero in on three crucial areas. First, really getting to grips with our own reactions to stress and its profound impact. Second, diving into the non-negotiable practices of infection control, super important. And finally, exploring essential scene safety principles, stuff that can genuinely make the difference between danger and, well, security. Okay, let's unpack this first part then. Stress. It's easy to just dismiss it as, a fleeting emotion, right? But what our research really indicates is its profound, far-reaching impact. It affects everyone, especially folks in high-pressure roles like, say, emergency medical care. The material really hammers home that major life events, losing a loved one, a serious injury, addiction, losing your job, even just relationship problems, these are massive stressors. But it's not just the big dramatic stuff. Even like preparing for a huge presentation or trying to learn something complex and new that can bring its own kind of significant pressure.
Yeah, and what's particularly insightful here is how universal the concept of stress really is, and also how our sources frame these normal reactions to stress.
Yeah.
It really points out that understanding not just what stress is, but how it can subtly affect you and the people around you. Well, that's the foundational first step. It's the key to managing it effectively and giving support.
Absolutely. And building on that, our sources really push us to look at a well-known model, but maybe through a fresh lens. Elizabeth Kubler-Ross's 5 stages of grief. Now, many people might only think of these stages: denial, anger, bargaining, depression, and acceptance only when talking about death, right? But what our material makes powerfully clear is that people experiencing any significant loss or traumatic event can cycle through these stages. And importantly, often not in some neat linear order. It can be messy. Think about it. Denial.
Yeah.
It isn't just saying not me after a tragedy. It could be that initial shock when, say, a big project at work fails, where you almost intellectually reject the outcome. It acts like a temporary buffer, a shield.
A protective mechanism.
Exactly. Then comes anger, that why me feeling. And this isn't always, overt shouting. It might be more like a simmering frustration at the situation, maybe at other people, or even directed inwards at yourself for things you think you did wrong. Our sources note that if this is unchecked, it can really lead to poor decisions or strained relationships.
That makes sense. It clouds judgment.
Totally. After that, we often see bargaining, that sort of but phase. This is the attempt to postpone the inevitable, maybe try and cut some kind of deal. It's driven by this desperate hope for a different outcome. In a professional setting, it might look like someone desperately trying to salvage something that's, well, clearly beyond repair.
Trying to find that loophole that just isn't there.
Right. Then there's depression. Our sources describe this as a heavy-hearted period. Now, this isn't necessarily clinical depression in every case, but it's a profound sadness, a feeling of despair and helplessness. It can be incredibly debilitating, often leading people to withdraw.
A very difficult stage to navigate.
For sure. And finally, acceptance. And this isn't about liking the situation or being happy it happened. That's a common misconception. It's really about coming to terms with the reality of it. Accepting what is. Our sources point out that this stage often requires quite a bit of external support, helping people accept what can't be changed and start figuring out a path forward.
And if we connect this to the bigger picture, especially in high-stakes work environments, recognizing these stages, maybe in ourselves, maybe in our colleagues, can dramatically improve how we interact, how we provide support. The words of wisdom sections in our sources really emphasize things like empathy, active listening, respecting privacy. These aren't just, soft skills. They're crucial reminders that we're dealing with people's intense emotional responses, not just the events themselves. So this brings up a really important question, doesn't it? How do you actually spot those early warning signs in yourself or in your colleagues, maybe before things escalate too far?
That's the million-dollar question, right? The critical first step. And our sources lay out some surprisingly subtle cues. Those red flags people often dismiss as just, oh, having a bad day. We're talking about things like sudden irritability, maybe noticeable changes in mood, difficulty sleeping, which, let's face it, for someone like an EMS provider with crazy schedules, that can be particularly insidious and hard to pin down. Anxiety, feelings of guilt or helplessness, changes in appetite, or even an increase in alcohol or drug misuse. These aren't just minor annoyances. Our sources say they're clear signs that stress is really taking a toll. So, knowing this, how do we pivot? How do we go from recognizing it to finding practical strategies for managing stress?
Exactly. And our research outlines three core components here: recognizing stress, preventing it where possible, and reducing it when it occurs. And for prevention, it's interesting. It's not purely about mental resilience, though that's part of it. It's deeply intertwined with physical well-being. The sources really emphasize cultivating a healthy, stress-reducing manner of living, and they particularly zero in on diet and hydration as foundational elements.
Okay, diet and hydration. Tell me more.
For healthy eating, the recommendation aligns pretty closely with established guidelines like the USDA MyPlate, advocating for a balanced variety of fruits, grains, veggies, proteins, dairy, and consciously limiting saturated fats, added sugars, sodium. You know the drill. But let's be real for a second. For anyone in a high-stress, unpredictable job, think an EMS provider on a 12-hour shift grabbing a healthy, consistent meal. That can feel almost impossible sometimes. And that nutritional deficit, it just compounds the stress.
Yeah, I can see that, feeling the fire, almost.
Precisely. Then there's adequate hydration. Drinking enough water, especially if you're in physically demanding roles or hot environments, isn't just about comfort. It's crucial to prevent dehydration, which can absolutely amplify feelings of stress and fatigue. It can cloud your judgment right when you need to be sharpest.
Okay, so diet, hydration, what else?
The third piece is physical activity. Regular exercise, along with getting enough sleep, another huge challenge in some fields, and engaging in personal hobbies, these aren't luxuries. Our sources frame them as vital for stress reduction. These physical activities, these leisure activities, they provide a necessary outlet, a counterbalance to the mental and emotional load of high-stress situations.
Okay, so that covers the internal landscape of stress, more or less. Now we can shift our focus a bit to the external threats. Those often unseen adversaries. We're talking about pathogens, which pose a totally different kind of threat in demanding environments. Our sources go into some really granular detail on bloodborne pathogens, thinking about infectious microorganisms like HIV, hepatitis B, hepatitis C, things that can be incredibly dangerous. And what's often misunderstood is the precise way these things actually spread.
Yes, and what's truly fascinating and important is the precise clarification the sources provide here. These pathogens, they're transmitted through direct contact with infected blood, semen, and vaginal secretions. And critically, the sources explicitly state they are not transmitted by things like sweat, saliva, tears, sputum, urine, feces, vomitus, or nasal secretions. Unless, and this is the key part, unless there's visible blood present in those fluids. This is such a vital distinction. It cuts through a lot of common myths and misconceptions. And it reinforces why certain precautions are so critical. Imagine like a patient's blood splashes into an open cut you have, or maybe you touch infected blood, then inadvertently touch your eyes or nose or mouth. That's where the risk becomes very, very real.
Okay, that clarification is huge. So understanding that, what are the practical real-world steps for prevention?
Well, our sources outline what are called standard precautions for healthcare workers. Think of them as universal rules designed to prevent disease transmission from anyone, because you can't always know who's infectious. It covers everything from wearing approved gloves and changing them frequently between patients or tasks to donning protective masks and eyewear, especially when splashes are expected. It's this proactive, consistent approach that really forms the bedrock of safety here.
Right, consistency is key.
Absolutely. If we zoom out and connect this to the bigger picture, it just underscores that simple, consistent actions make a monumental difference. They break that chain of infection, which leads to a fundamental question. If you had to pick just one single step to prevent disease transmission, the most important one, what would it be? Our sources are totally unequivocal on this. The most important step you can take to remain healthy and reduce the transmission of any disease is to wash your hands.
Hand washing. Seems basic, but clearly critical.
It is basic, but the technique matters. The guidance isn't just about a quick rinse. It's about washing thoroughly with soap and water for at least 20 seconds. Sing happy birthday twice, you know. And if soap and water aren't available right then, an alcohol-based hand sanitizer is the next best thing. Knowing when and how to use each properly is part of that critical knowledge base.
Okay. And it's not just bloodborne threats we need to worry about, is it?
No, absolutely not. Our sources also highlight airborne pathogens. I mean, we've all just lived through a major global health event with COVID-19, which the sources specifically reference, actually, as a respiratory illness caused by a new coronavirus that spread incredibly rapidly. It really underscores the urgency of understanding and using airborne precautions correctly.
So what kind of specific precautions do the sources recommend for those airborne threats?
Well, it includes several layers. Things like staying acutely aware of what's happening in the community or their outbreaks, meticulously assessing patients when they arrive, asking about recent illness or exposure history, performing rigorous hand hygiene that comes up again and again, and crucially, using the correct personal protective equipment, or PPE. We're talking about things like disposable surgical masks or sometimes N95 respirators for higher risk situations, and definitely eye protection. There's actually a words of wisdom box specifically on COVID-19 in our sources. It gives actionable advice that honestly remains incredibly relevant. Wash hands often, avoid touching your face, cover coughs, wear masks in public spaces where needed, practice social distancing, and importantly, stay home if you're sick.
Right. Those became second nature for a while, didn't they? And speaking of PPE, you mentioned masks and eye protection.
Yes, and the sources offer really detailed guidance on what specific PPE to use and, critically, how to use it effectively. It's not just about having it, it's using it right. For instance, an EMR, that's an emergency medical responder, might need an N95 respirator, maybe a face shield, or goggles, depending on the specific risk assessment of the situation. For a patient who might be the source of an airborne infection, it could be as simple as placing a surgical mask on them or using a nasal cannula to help contain respiratory droplets. What's particularly critical, and something that's often overlooked in training or practice, is the sequence. The material even includes illustrations on the correct donning, that's putting PPE on, and doffing, taking it off sequence. It's all about ensuring you don't contaminate yourself in the process of removing potentially contaminated gear. There's even a specific skill drill focused just on safely removing medical gloves without touching the contaminated outside surface. Seems like a small detail, right? But if you mess that up, it has huge safety implications.
Wow, okay. That level of detail on putting it on and taking it off makes a lot of sense. You could undo all the good work otherwise.
Exactly. Contamination during doffing is a major risk point.
Okay, so we've covered internal stress, we've covered microscopic threats. Now let's shift gears one more time to the immediate and visible dangers. Let's talk scene safety.
Our sources really emphasize that assessing the environment is absolutely paramount. It's the first thing you do before you even think about entering a potentially dangerous situation. And we're talking about a whole range of things here, from unstable objects like maybe damaged vehicles after a crash, precarious trees, utility poles, building debris, stuff that could fall, collapse, or even explode, to sharp objects, things like broken glass, jagged pieces of metal, or discarded hypodermic needles, which can easily cause injury and, as we just discussed, transmit disease. Yeah, and what's really comprehensive here is the sheer breadth of potential hazards. The sources flag. It's not just the obvious stuff. They mention fire, which obviously demands immediate evacuation and specific firefighting protocols. They talk about animals, which could be anything from unpredictable pets at a residence to wildlife at an outdoor scene. These can pose real threats and might need to be secured. And even weather and environmental conditions, things like extreme heat or cold, require appropriate gear, proper hydration, and just an awareness of risks like hypothermia or heat stroke. So with such diverse and dynamic risks potentially always present, how do you quickly identify and manage them effectively, especially when you're in a rapidly unfolding situation, often under immense pressure?
That's where another critical tool comes in, especially for identifying those less obvious dangers, the chemical ones. The sources point to the 2020 Emergency Response Guidebook, or ERG, specifically for dealing with hazardous materials hazmat incidents. These are situations like maybe a tanker truck crash on the highway or an industrial accident involving substances that could cause significant harm. Things like flammables, explosives, corrosives, poisons. The guidebook uses those standardized placards, you've probably seen them on trucks, those diamond-shaped labels with specific numbers and colors.
Yeah, the diamonds.
Right. They can instantly tell trained responders whether they're potentially facing an explosion risk or a toxic gas or something else entirely. It guides their initial approach, how close they can get.
And connecting this to the bigger picture, for anyone who might encounter such a scene, even if they're not a hazmat tech. Simply knowing what those placards signify at a basic level and understanding fundamental principles of hazardous material response, like that cardinal rule you often hear, stay uphill and upwind from the scene. Why? To avoid dangerous fumes or liquids flowing downhill or being carried by the wind. That alone is crucial knowledge. Our sources are very clear on this. You should never approach an unknown hazardous material scene unless you are specifically trained and equipped to do so. Full stop. This raises another important point, though. Beyond the immediate danger at the scene, what about afterward? What about the proper disposal of potentially hazardous materials, especially contaminated items, once the scene is secured or the patient is treated?
Good question. And our sources definitely highlight the absolute importance of proper disposal, specifically for sharp objects like needles and any materials contaminated with blood or body fluids. These need to go into designated sharps containers, those red puncture-proof boxes, and specific biohazard bags, not just tossed in the regular trash. And here's a really important detail, something that might seem small but often gets overlooked in practice. The sources explicitly warn against recapping or bending used needles. It seems like a minor action, maybe even tidy, but if you ignore that warning, it can have catastrophic safety implications. It's a primary way healthcare workers get accidental needle stick injuries and potential exposure to dangerous pathogens.
Yeah, that simple rule, never recap, saves lives and prevents infections. It's drilled into you in training for a reason. Hashtag tag tag outro.
So let's try and wrap this up. What's the big picture here after this deep dive? We've journeyed through the essentials of workforce safety and wellness, haven't we? We've gone beyond just a surface-level chat about stress and grief. We explored its 5 stages, not just as abstract concepts, but as real, sometimes subtle ways they show up in ourselves and others. And we looked at practical ways to manage stress diet, hydration, activity. Then we tackled the critical importance of infection control. From visible bloodborne threats to those unseen airborne pathogens, we really hammered home the absolute necessity of rigorous hand hygiene and the correct, precise use of personal protective equipment, the what, when, and how. And finally, we navigated the complexities of scene safety, identifying everything from unstable objects and sharps to hazardous materials using things like the ERG and placards. And we touched on the critical importance of proper disposal.
Absolutely. And the wealth of information we've explored today, pulled from all these sources, it really underscores a powerful truth, I think. Your personal well-being. It's intrinsically linked to your ability to perform effectively and safely, especially when you're in demanding roles. It's not one or the other. It's not just about reacting to danger when it happens. It's really about proactive knowledge. It's about preparation that keeps you, and by extension those around you, safe. It reminds us that vigilance, staying safe, it's a continuous, evolving practice, not a one-time checklist.
That's a great way to put it. Proactive knowledge and continuous practice. So, as you, our listener, reflect on this deep dive, maybe consider this. What is one small, everyday change you could make, starting right now, to enhance your own personal safety and wellness? And how might that, in turn, ripple outwards, enhancing the safety and wellness of those around you? Think about how these principles, often designed for really high-stakes environments, could maybe